Good afternoon. We'll go ahead and get started, and we'll start with an update from the number of cases of COVID-19 in Iowa that was released earlier this morning. Today we have 19 new positive cases for a total of 124 positive cases in Iowa. 272 total negative tests were negative today for a total of 2,315 negative tests and a total of 2,439 total tests. That includes 4 new counties, Buchanan, Cedar, Jasper, and Warren, for a total of 30 counties. We have 18 hospitalized as of last evening, 17 as of right now. We had 1 discharged from the 7 last night. We had 2 that were, 2 of the new were recovering at home, and 9 of those hospitalized were already in the hospital and tested positive based on the criteria that we're using for testing. You know, since the day that we first learned of COVID-19 was here in Iowa, I've asked Iowans to remain calm and to stay informed. Having the most up-to-date information from credible, reliable sources is so important during these times. I made a commitment to do my part to keep Iowans informed, and today I want to take the time to thank some of the people who have really made that possible. To the Homeland Security and Emergency Management and the Iowa National Guard, thank you for standing up the State Emergency Operations Center, and for making sure those of us who are leading the response effort are informed and prepared to deploy the necessary strategies and policies. To the incredible team at the Iowa Department of Public Health that is truly on the front line protecting the health of our people, thank you for making sure that Iowans have the information and the know-how that they need to make a difference. To Director Claybaugh, Dr. Padati, and Sarah Reister, and to the staff manning the 211 call center, your expertise is reassuring to Iowans during these challenging times. Finally, to my team here at the SEOC, I want to thank you for supporting me and the Lieutenant Governor each and every day. And to the rest of the team back at the Capitol, Team Capitol, thank you for taking every call and answering every email and letter from Iowans looking for answers. I want you to know that you're making a difference. Each day, my office issues a press release with the daily update of the number of positive COVID-19 cases in Iowa, with the age range and counties of residence for each of the affected individuals. This information is also posted on the Department of Public Health website and on a new website launched earlier this week, which is coronavirus.iowa.gov. The new website is intended to be a one-stop shop for Iowans looking for any type of information related to COVID-19 mitigation and response efforts in our state. The website will guide you to a variety of useful information from state agencies on topics such as health and human resources, employment and unemployment, business, education, travel and transportation, as well as public safety. I will also continue to hold press conferences on a near daily basis to update you on timely information, and you can, of course, tune in live on my Facebook page and on iowapbs.org. And I also want to extend my gratitude to Iowa PBS for their public service during this time. They've made it possible for us to implement social distancing measures here at the SEOC that protect our team as well as the media, and we greatly appreciate that partnership. Finally, for the latest information about COVID-19, how to prevent it, and what to do if you're exposed or become sick, go to the cdc.gov for the most up-to-date, accurate information. You can also tap into your favorite media outlets for information and stories about COVID-19 and how it's affecting our state, nation, and countries around the world. And then there's social media, which can be both a blessing and a curse during these challenging times. Be intentional about how you are using social media. If you're looking for news and information, follow credible sources. Don't just rely on what pops up in your news feed. Social media is a great way to stay connected with friends and family, especially while we're social distancing and spending more time at home. But it's also ripe for misinformation, false narratives, and harmful rumors and speculation are not helpful at a time like this, and don't be a part of it. It only adds to the anxiety that so many people are already experiencing. So know the facts. We are reporting positive cases daily, and the Department of Public Health and local public health officials are working with those individuals and those communities. And if you have questions about how to treat the virus, check the CDC website or talk to your doctor. It's so important that we don't get distracted by the noise and that you get the information from credible, reliable sources. So please stay informed, again, remain calm, and take all preventative measures to protect your health and the health of your fellow Iowans. Wash your hands, cover your cough, work from home if you have the option, stay home as much as possible, practice social distancing, and don't put yourself or others at risk of exposure. We can do this, and I'm counting on all Iowans to help us as we work through these unprecedented times. So with that, I'd like to ask Sarah Reister from the Department of Public Health to say a few words. Sarah?
Thank you, Governor Reynolds, and thank you to all Iowans who are following the guidance of the governor and the Iowa Department of Public Health in practicing social distancing, avoiding gatherings, teleworking, telelearning, staying home when you're ill, and continuing to use good personal hygiene habits like washing your hands often, covering your coughs and sneezes, and cleaning surfaces frequently. We've heard your questions about shelter in place or stay-at-home orders, and we appreciate that Iowans want to do everything possible to keep themselves, their loved ones, and their communities healthy. While sheltering in place is a tool that is currently being used in other states, we do not believe it is a mitigation measure that is necessary in Iowa at this time. It's important to understand that sheltering in place for 2 or 3 weeks will not cause the coronavirus to go away. That's because this virus is circulating around the world and can be reintroduced into communities from different places. There is no current treatment or vaccine available at this time, and that's why it's so important that we use the public health mitigation strategies that are available to us at the right times. Mitigation strategies recommended by public health are used as part of a layered approach intended to slow the spread of the virus in our state. The Iowa Department of Public Health will continue to recommend implementation of additional mitigation strategies when we determine those additional strategies to be necessary. As we move through this public health emergency, our recommendations may change over time, depending on the data we see about how this virus is impacting our communities. We may recommend adding more stringent mitigation strategies, and we also may recommend lifting mitigation strategies. Think of this as a dial and not a switch. We will recommend turning the dial up and down over time. That's how we will slow the spread of the virus in our state in order to prevent overwhelming our healthcare system and to protect our healthcare workers and our vulnerable populations. Right now, public health has recommended a number of mitigation measures. These include school closures, increased teleworking and telelearning, limiting unnecessary travel, especially among our high-risk groups, which include Iowans over 60 and those Iowans with underlying health conditions, limiting visitors to healthcare facilities, avoiding gatherings, staying home when possible, and social distancing when we do need to be out in the community. Metrics that we are looking at when we make recommendations about mitigation measures that should be implemented include the percent of our population that is 65 or older. This tells us how many members of a particular community might be vulnerable. The percent of identified cases requiring hospitalization. This tells us how severe our identified cases are. The rate of infection per 100,000 Iowans in the past 14 days. This tells us how many cases exist in a community within the most recent incubation period of the virus. The number of outbreaks in settings like long-term care facilities, where our older populations and Iowans with underlying health conditions live. This tells us about clusters of illness that exist among vulnerable populations in a shared community setting. We look at all 4 of these factors in addition to information about the experiences of other states in making recommendations to Governor Reynolds and to our local community partners about what mitigation strategies are appropriate now to control the spread of the virus in our communities. We are analyzing this data daily and will continue to make recommendations necessary to slow the spread of the virus in our state. We know that this is a difficult and uncertain time. Public health will continue to make the right recommendations at the right time, and we appreciate you sharing these messages with your family, friends, and neighbors. We all have a role to play right now. Stay home as much as possible to avoid potential exposure to the virus. That's especially needed for those of you who are over 60 or who have underlying health conditions. Practice social distancing when you do need to leave the house. Work and learn from home if possible. Avoid large gatherings, and call ahead before visiting your healthcare provider if you do become ill with a fever, cough, or difficulty breathing. Clean surfaces regularly, and always practice good personal hygiene like hand washing, covering coughs and sneezes, and staying home when sick. Thank you.
And with that, we'll open it up for questions.
Governor Reynolds, yesterday, President Trump cited Iowa statistics in his desire to reopen the country as quickly as possible. And today, he mentioned he'd like things to get back to normal by Easter. Is that your desire as well?
Well, we want to get things back to normal as quickly as we can, and that's why we've taken the various steps that we've taken, because all along, by implementing the policies and procedures that we put in place, we've done that as a means to bend the curve and hopefully prevent overwhelming our hospitals and our public health workers. And so that's been the intent all along. And if we can do that and we start to look at some of the metrics that we're evaluating different areas of the state, that will also help us in making our decisions to bring parts of Iowa back online as well. So as long as we're continuing to work and base these decisions off of the data that we have, taking into context what other states are doing and what some of the CDC guidelines are, then I hope that's really how we can strategically and systematically maybe look at areas that we have to make some different decisions about and look at other areas that we might be able to start that process to bring some of these businesses and open up some of the restrictions that we have. I'm not prepared at this time to say a date because all along the decisions are so fluid. What I say sometimes at a press conference after we receive new data, I have to stand in front of Iowans the next day and I've made a different decision. But that decision has been made based on the data that the Department of Public Health and their expertise has provided us, along with other factors that we've taken into account as well.
So in the instance when you would have hot spots that would still have restrictions, would you defer to mayors and county boards of supervisors, or would you make that decision?
Well, I think we would work with them, and if we take a look at the metrics, that we can provide them some of the data. Working with them, it would let us know perhaps if social distancing is being followed or if it's working. Are there additional measures that we can take to help get the message out and help bend the curve and maybe prevent us from taking that final step of asking people to shelter in place? It would allow us to really assess the regional health care opportunities when it comes to PPE, protective personal equipment, or workforce capacity. So that's also a factor that goes into those decisions that we're making. So really, when we have the same criteria and we're consistent in what we're basing our decisions on, that helps mayors, that helps communities, that helps our healthcare partners. It helps us all feel confident as much as we can be with a very fluid situation in making the decisions and the recommendations that we are moving forward.
May I ask a kind of follow-up to that?
Yeah.
Two-part question. First, are you willing to make your own independent decision, even if the president makes a different decision for the nation? How do you protect Iowans on your own basis? And the second part of that is, how do we know when we've bent the curve? Is there some metric or measurement to give us an indication of, okay, we've gone far enough, now it's safe to open up commerce again?
And chances are, even though we flatten the curve and we work out of it and we're bringing industry back on, there's the potential until we get a vaccine or a cure that it's going to tick back up at some point. So we have to take that into consideration when they're making these recommendations. I'm going to base my recommendations on what I'm seeing in the state of Iowa based on the data that I have, but one of the elements that we look at is what's happening in other states across the country. So at least twice, if not 3 times a week, I have the opportunity to jump on a call with governors from across the country at least 1 time a week. That includes the vice president and often the president, so we can get an up-to-date overview of what's happening at the federal level, things that we need to be looking for and taking into consideration some of the data that they're seeing in states that have really become hotspots, and then to have the opportunity to talk with governors and find out what their what the metrics they were using and what did they use, what kind of criteria to make some of the decisions they made, when and how, is just helpful. But you have to take a look at your own population. We're not as densely populated as New York. We're more of a rural state. We have pockets of more densely populated communities. So all of those factors go into that. I know, Sarah, do you have anything to add to that?
All those folks who are hospitalized, do we know how they're doing? I mean, what, obviously there are various levels of how one would be in the hospital, ventilator, et cetera. Do we know how they're doing? I don't know if Sarah might know that or what.
Sorry, I don't have that level of detail to share at this time.
Is there a reason why we've seen such a jump? I mean, from 7 to 18, seems like
It's still a relatively small number, but we don't want to see, the more that we can prevent from being hospitalized. But remember, part of the criteria for the testing from the state hygienic lab is hospitalized patients with a fever, respiratory failure, and no other diagnosis that they can tie that to. And so, of course, that's the individuals that we're testing. And so I think of the new ones, 9 fell into that category. Is that correct? Yeah. 9 fell into the category of individuals that were already hospitalized, that they had tested and found out that they tested positive.
so among the hotspots that we have in Iowa, it kind of makes sense they would be in populations like County, Johnson County. Is there anything that you're seeing now that we're in 30 counties in Iowa that indicates anything you could say to Iowans about the shape of the spread or the contour of the spread that tells us anything? That could be informative to Iowans about how this is spreading and what we can do about that?
Yeah, I think what I would say in response to that question is, the governor announced, I think it's been a week and a half ago now, that we had identified community spread of the virus in our state. And there's a 2-week, roughly incubation period for life cycle of the virus. And so I think that the spread that we've seen is what we anticipated. And we anticipated this, and we do anticipate we're going to continue to see our case numbers go up this week. We think it'll take some time for the impact of the social distancing measures that people are practicing right now to be able to be reflected in our case counts. And so that's what we're hoping to see, that over time those increases will kind of slow down. And we do anticipate that the virus is going to be around for a while, but as the governor has explained, the idea here is to flatten the curve so that we don't have a peak in cases all at once and overwhelm our healthcare system.
Sarah, this one's probably for you, but I probably want to hear from the governor for thoughts on this as well. Yesterday we had a reporter who asked how many beds, ICU setups, masks, ventilators the state has, and the Department of Health replied saying that information is confidential as part of emergency protocols. But you look at California, New York, Illinois. For example, Illinois is telling that they have 1,764 ICU beds. California is saying its numbers. Illinois is saying how many ventilators it has. Why is that information being kept from the public when other states are releasing that information, and should it be kept from the public?
So we are actively in the process of understanding what the bed availability is in the state. And part of that calculation is understanding not only how many beds are available, but do we have staffing to support all of the beds. And so we're continually working with our hospital systems, with our healthcare systems, within our healthcare coalitions to understand what the capacity is and what the surge capacity might be and what the patient transfer protocols might look like in the event that we do have a particular hospital that doesn't have the capacity to admit any additional patients. So we're still very much working on that. I mean, the question of how many beds, we do have some of that information, but it's not always as meaningful as you might think because it doesn't necessarily also indicate, if those beds are staffable at a particular time or not.
Sure, but, following up, even if the numbers don't necessarily have a meaning, isn't that something the public should be able to know and take meaning from? And are some of the numbers, do we just not know them right now?
Well, I think it was yesterday I did get the number of beds, so we do have that, and we can get that, and the certificate of need identifies that. But to Sarah's point, there's so much variability in that, and so it's okay to give that information out, but if it's not really factual or helpful, depending on workforce, depending on the need, depending on the type of bed, that goes into it also. I also said yesterday that PPE continues to be a #1 concern, and it's a concern of governors all across this country, and that's why we are taking all hands on deck in looking for ways to order not only directly from the providers, but also through FEMA. We're putting in orders there. We're talking to businesses all across the state. We're working with Department of Corrections. I mean, every hour we have various teams working on solutions to masks and ventilators. And, I talked about yesterday, if you're providing a hospital that's providing electric surgeries, maybe you should stop doing that for a while and make that PPE, that equipment available for some of the hospitals. We also have a task force that's working on, the backup in case, what are the alternatives in case we have a hospital that is at capacity or surge. So that is happening all across the state, and those discussions are taking place with the 7 healthcare coalitions. We need to look at this from a regional perspective as well, and those conversations are taking place. I think I've heard Dr. Padotti and Sarah say multiple times every hospital has a pandemic plan, and they should have that out and be going through it and know what they need to do when we are in a situation like we are today. But that doesn't mean that you can't adjust. We are in unprecedented times right now, and so we're going to continue to be flexible, adjust, and figure out a way that we can meet the needs of Iowans. And our workforce is another piece of that. Also, through the health emergency declaration, we've made some changes to allow retired healthcare professionals to come back online, for students to come into the fold. So, I mean, every day we're looking at different solutions that we can provide Iowans to make sure that we have the services available for them.
Jump to folks on the phone now too. So, Rachel Drozey, the next question is yours.
Hi, Governor. We keep getting questions about the essential versus non-essential workers at our station. So some people are telling us that they still have loved ones that are being called in, but they feel their jobs are non-essential. So what should they be doing? What conversations should they be having with their employers right now?
Yeah, so we have stood up a legal team, and I can have Sam, who is my legal counsel at the governor's office, maybe talk about a resource if there's questions on whether they are or not, or they have some concerns with what they're being told. We will follow the guidelines for essential workers that is on the Homeland Security and Emergency website, and they have laid out, I think there's 17 different categories, and I can get that information to you, but they have done a great job, and I think most states are using that same criteria for essential workforce, and it lists them and then gives some criteria underneath that.
Brianne at the Register, you have the next question.
Hi, Governor. I want to go back to some of the president's comments this week. He said that we can't allow the cure to become worse than the problem. How long would you be willing to keep businesses and schools closed here in Iowa to combat this spread?
Yeah, well, I'm just not going to speculate on that. As I've said all along, I'm going to continue to make decisions based on the data, utilizing the expertise that I have in the Department of Public Health, working alongside the CDC, taking a look at what other states are doing, really walking through some of the metrics that Sarah talked about earlier, working with communities across the state, and we'll take a look at what makes sense for us to either extend or start to bring some of those sectors back online. So, we meet in the morning and we meet in the afternoon. We identify the 3 hot spots for today and what they are for the next 3 days, and then we reassess at the end of the day. And so they are running numbers all the time, working with communities and individuals across the state, and we're going to continue to do that and base our decisions on the data that we have in front of us.
Next question, Dave Price, Channel 13.
Good afternoon, Governor. Can you tell us how many people can be tested right now?
Yep.
And would you, this may be a question for Sarah too, but would the state lower the threshold to qualify for a test if you had more of them available? And where are you trying to get these test kits?
Yeah. So right now we have the capacity to test 1,542 Iowans. We just got a new shipment, but those are the tests through the state hygienic labs. So, and we have a set criteria that we're using for that testing, and they have continued to broaden that out. But there are also other labs that have come online that physicians, when they are counseling their patients, they can order a test and can run it through the other labs as well. So that's a part of the scenario as well, and they make that decision. They're not following necessarily, I don't think, Sarah, if you want to add to this, please do, the guidelines that we have at the state hygienic lab.
Yeah, I would just add that, clinicians are free to use their clinical discretion in ordering a test through one of those national labs. The criteria that I laid out earlier and that the governor was referencing related to the state hygienic lab, those are for tests of public health significance, and so that's why the criteria is in place. That has expanded over time to the extent that additional testing capacity exists at the state hygienic lab. We might see that continue to expand further, but at this time, because we do have health systems that are doing in-house testing or getting ready to come online with that, in addition to national lab availability of tests, clinicians are free to use their independent discretion to access those other avenues for testing if they'd like.
That's a good point with the hospitals coming online too, because I think the turnaround time is quicker too. Is that correct? Which is helpful. And that continues to narrow as well.
KCRG, next question.
Hi, Governor. This is Beth Malicki. Dr. Tony Myers of Mercy Medical Center in Cedar Rapids says even though they have doubled their ICU bed capacity, they project that in 3 weeks they will have great stress on their system, possibly even be at capacity with their ICU beds with the social distancing that you have recommended. And they are begging for an order for shelter in place, as has the mayor of Cedar Rapids, Brad Hart, and the city manager. Do you still maintain that simply doing this layered approach that you've mentioned today is enough?
I do, and I will continue to make the decisions based on the metrics that we've laid out, working with them if they, want to take a different decision. But I think did you have a call with them today, or was that yesterday? They had a call with them today to walk them through the metrics, to provide the data that we are using, and it is very fluid. It changes. They sent some information that they were operating off of to our office yesterday, and it is completely changed from what it was yesterday. So it is fluid. The information is changing almost on a daily basis, and we will continue to monitor it from that perspective. I appreciate what they're saying, and I'm taking that very seriously. So I don't want Iowans to think that I'm making these decisions lightly, but I have to be consistent in using the data that I'm using to make the decisions that I'm making. And I and our team are more than happy to, consult and reach out to Iowans, to the hospitals. We meet daily with the hospitals. I know there's some concern, and there should be, with the PPE. We're looking for solutions from that perspective as well, but we're more than happy to sit down and walk through any concerns that they have, provide them with the data that we have, and then hopefully come to some, solution.
Aaron Murphy, Lee News.
Thank you, Governor. I also want
real quick to the president's comments, only because I know your responsibilities to Iowans, and so what I'm curious to hear from you is whether you have any concern that there's maybe becoming an inconsistent message. Iowans tune into to your press conferences, but they also tune into the president. So do you have any concern that they listen to you and your message has been consistent all along about staying at home and taking all the right precautions, and then they tune in to the president's press conferences and hear him say things like, I want to get businesses open in a couple weeks or by Easter? And what would your message be to Iowans who are hearing those inconsistent messages?
Yeah, thank you for that question. So I want to get business back to normal as quickly as I can, too. I think we all have that shared goal. I just want to make sure that I'm protecting Iowans and I'm making the decisions on the right data points. And so, as I said earlier, we're going to continue to evaluate the data on a daily basis, see where we're at, and make those recommendations going forward. But, he also has said, the 15 days aren't up, and he's really asked Iowans to shelter, to really practice all of the things that Sarah just listed for 15 days. And by doing that, we really do believe that across this country we can bend the curve and get business back to normal sooner rather than later. And, my hope is the same. So I hope, Iowans are listening and paying attention. I said yesterday nobody reported it, but, we had DOT run some numbers, and passenger traffic was down almost 50%, where our truck traffic was where it was a year ago. So commerce is moving, and we're getting food to grocery stores and products out, but overall the passenger traffic was down about 50%. So thank you, Iowans. Thanks for listening and doing your best and to be a part of the solution. I did a conference call this morning with pastors from all across the state, and they're doing what they can to be helpful in communities. They've been a valuable resource to prop up daycare centers, emergency daycare centers where we need them in communities. We've had the Y step in, and they've offered workforce to help, stand up some of those emergency daycare centers. So, Iowans are doing what Iowans do, and that is to be responsible and to do the right thing. And I think they know, you've heard me say 100 times, Iowa is one big small community, one big small town, and we take care of one another. And that's what Iowans are doing. That's what I would expect Iowans to do. And the more that we do that, then maybe we can get life back to normal, and we can hit some of those metrics that the president was talking about at his press conference yesterday.
We're going to go to Jason Clayworth, the Des Moines Register.
Ms. Restetter, you indicated that your department's recommendations related to coronavirus restrictions are based on criteria such as age and rate of hospitalization. Can you please provide Iowans a few more specifics? Specifically, how many confirmed coronavirus cases and related hospitalizations and deaths must there be in Iowa before a stay-at-home order is recommended? And do you have like a sliding scale of criteria to assess when such an order is necessary?
Yeah. Hi, Jason. We analyze all of these factors together that I explained earlier. And so that is the percent population greater than 65, the percent of identified cases requiring hospitalization, the rate per 100,000 population in the past 14 days, and the number of outbreaks that we might see in a long-term care or other community residential setting like that. And so taking all of that information all together, we would assess that. And if we feel like in combination that there's a concern, that would be the point of time in which we would reach out locally and also make a recommendation to the governor that we thought additional mitigation strategies might be necessary. So we would look at all of those factors together. It's not just, for example, if we have 15 hospitalizations in a particular county. We look at all four of the factors in conjunction with each other to make those sorts of recommendations.
Last question will be Caroline Cummings with KDAN.
Hi, Governor. I have two questions. One, and they're related. One is about, we've gotten responses from viewers saying that the unemployment claims website has been finicky and crashing, so they can't file their claims, and that no one is there to answer the phone. So I'd ask you, what maybe you guys are doing to mitigate that. And secondly, lots of questions about what do self-employed people do regarding unemployment claims and any sort of benefit they can get from the state?
So I will make sure that we follow up on your first question. That's what I get for bragging on a system the day before. I should have known better to do that because the volume is high, and I really appreciate Iowa Workforce Development and the turnaround time they've been able to stand this up and really process the number of claims that are coming through. They've just, been a large number, and we all knew and expected that. So I will check on that. I will tell you they're working around the clock to make sure that they're meeting the needs of Iowans. Let's see, what was the second question? I forgot.
Self-employed.
Oh, self-employed. So
About-
we're watching what they're doing with the CARES Act in Washington, D.C. I don't know. I haven't heard that anything's moved as of yet. So we're going to see that's, I think, identified in the bill right now. And so, but things are mobile. It's not finalized yet. So we'll watch and see what happens with that, and then we'll see what we need to do from a state perspective. Thank you.
Yes, yesterday.
Pages